so you know a little bit about our organization. We were created back in 2011 when MSD, the global pharmaceutical company, committed $500 million to helping end preventable maternal deaths worldwide. Nigeria is one of our 4 focus countries, so we're very serious about partnering here and helping to support government efforts, as well as all of your efforts in reducing maternal mortality. And I think the message I want to leave all of you with is speaking a little bit about why working in Nigeria, aside from personal reasons, is really exciting to our team. It's really about all of the energy, all of the social entrepreneurship, the power of the private sector, the enabling environment for public-private partnerships, and the work that all of you are doing to make sure that voices of women are not just heard, but they're actually integrated into the solutions. Because at the end of the day, if we're not responding to the needs of women, if we're not making that childbirth experience a joyful experience, something that they will remember, something that will improve and increase their trust in the health system, so that it is actually an opportunity to put women and their families on the pathway to lifetime health and well-being, we are not doing our jobs. The other message I want to leave you with is that we we have successes that we can build on. I want to share a couple of them from some of our partners. So many folks mentioned, in the north where we have the highest maternal mortality rates and the difficulties of working there, including in some of the crisis zones. One of our partners, Girl Child's Concerns, has worked with young women who are being resettled in those communities, providing education for them to become village health workers as well as midwives. And that program has seen successes in terms of up to 400% increases in utilization of primary care services. So we know that when we pick the right types of interventions, work with the right folks, and really invest in human capital in our communities, we can have an impact. And that increase in utilization in the primary care centers is not just around family planning, maternal health services, but also for child health services and vaccinations. So you see the ripple effects of all of these efforts. The Honorable Minister talked about family planning. We know that if we address the unmet need for family planning, we will reduce maternal mortality rates by up to 30%. We know in our country, most girls and women are receiving family planning services and products from local private providers, PPMVs, community pharmacists. We need to make sure that the quality of services that they're receiving from these providers are high. We need to make sure that they're counseled appropriately when they're seeking services, because these are the folks who are providing services to women and girls in the communities that they live. We need to go where they are, meet them where they are, and provide the right services where they are. I'd also like to end, some of you have heard this story if you were there yesterday, the work that we're doing in Cross River State with Partners USAID and Pathfinder that actually showed 66% reductions in maternal mortality. I have to tell you, I've been doing this work for a couple of years now. Nowhere else in the world has demonstrated 66% reductions in maternal mortality rate that have been able to be linked to a specific intervention at a population level, at a state level. That is something all of you should be proud of. It's something we should figure out how to replicate, not just in Nigeria, but outside of Nigeria. And it's something that we should be spreading the word around what is it that created those successes and what drove those successes, and let's lean into them. So I'll stop there. I'm really excited to hear what's going to happen, what's going to come out of the panels, hoping that I can get a little more intelligent by the end of the day by what I learn from all of you here, and figure out how to incorporate and integrate that into the thinking of MSD for Mothers. So thank you so much.